Hi, everyone. Thank you for being here today. I'm really looking forward to exploring with you a topic that's been rapidly gaining interest in both the scientific circles and the broader public conversation: psychedelic-assisted therapy. Specifically, we'll be looking at three compounds that have drawn the most research attention recently: MDMA, psilocybin, and ketamine. We'll explore where the science currently stands, what this therapy looks like in practice, the kinds of conditions it may help with, and where things might be headed. Along the way, I'll also touch on how this approach fits within a more integrative or holistic view of health, something I sometimes describe through a concept called Coherent Genesis, which highlights the idea of health as a process of restoring and sustaining wholeness across our mind, body, and life experiences. So what do we mean by psychedelic-assisted therapy? It's not simply taking a psychedelic substance and hoping for insight. Rather, it's a carefully structured therapeutic process that combines psychotherapy, meaning guided conversations and emotional exploration, with the judicious, supervised use of psychedelic compounds. The goal is to facilitate profound shifts in perception, emotional processing, and meaning-making, which can help address deeply rooted psychological or existential challenges. This is very different from recreational or unsupervised use. In clinical research and emerging therapeutic protocols, these experiences are carefully prepared for, guided, and integrated afterwards with trained therapists. Now let's break down the three most studied substances in this area. MDMA, sometimes known by its street name ecstasy, is actually not a classic psychedelic. It's called an empathogen because it primarily enhances feelings of empathy, connection, and openness. In controlled therapeutic settings, MDMA is showing remarkable promise, especially for post-traumatic stress disorder or PTSD. Large-scale studies, including phase 3 clinical trials, have found that MDMA-assisted therapy can significantly reduce PTSD symptoms, often in people who haven't responded to traditional treatments. It seems to work by dampening the fear response while increasing access to emotional memories, allowing people to process traumatic experiences without becoming overwhelmed. Psilocybin is the active compound found in certain magic mushrooms. It's a classic psychedelic that alters perception, sense of self, and often induces powerful experiences of interconnectedness or transcendence. Clinical trials are exploring psilocybin for major depression, end-of-life anxiety, substance use disorders, and even obsessive-compulsive disorders. The FDA has designated psilocybin as a breakthrough therapy for depression, fast-tracking research. Studies show that even 1 or 2 psilocybin-assisted sessions in a structured therapeutic context can lead to substantial and sustained reductions in depression scores. Ketamine is a bit of an outlier. It's long been used as an anesthetic and for pain management. Unlike MDMA or psilocybin, it's legally available in the US right now for treatment-resistant depression, often administered as an infusion or nasal spray. Ketamine produces a dissociative state that can rapidly reduce suicidal thinking and severe depressive symptoms, sometimes within hours. It doesn't rely on serotonin receptor activation like classic psychedelics, but may enhance neuroplasticity, helping the brain rewire unhealthy patterns. It's important to understand that it's not just about the drug. The therapy is equally critical. The process typically involves 3 stages, the first of which is preparation sessions with a therapist to set intentions, build trust, and discuss possible experiences. Second, the medicine session itself, usually in a calming, safe environment with a trained therapist present throughout. The third stage involves integration sessions afterwards, where the insights and emotions that came up are processed and explored to support long-term healing. This combination helps prevent people from simply having a profound experience that then fades without meaningful life change. Integration is where insight becomes new patterns of being. While we need continued research, current evidence and early approvals focus on several areas. Post-traumatic stress disorder, or PTSD, especially with MDMA-assisted therapy. Major depressive disorder, with psilocybin and ketamine showing rapid, sometimes long-lasting effects. End-of-life existential distress, helping people facing terminal illness reduce anxiety and find meaning. And substance use disorders, where psilocybin is being explored to help disrupt entrenched addictive cycles. Some researchers are also beginning to investigate applications for eating disorders, obsessive-compulsive patterns, and even broader existential or spiritual crises. So why might psychedelics be so powerful? On a neurobiological level, psychedelics seem to reduce activity in the brain's default mode network, which is tied to rigid self-referential thinking. It's the voice in our head that can get stuck in loops of depression or rumination. They may also increase connectivity between different regions of the brain, fostering new perspectives and mental flexibility. On a psychological level, they can bring repressed or avoided emotions into awareness, or create experiences of profound connection to others, to nature, to a sense of something larger that reshapes how people relate to their suffering. This fits into a more integrative or holistic view of health that sees healing not just as a reduction of symptoms, but as a fostering of coherence, a felt sense of wholeness, alignment, and meaning. That's very much in line with what I sometimes describe through the lens of Coherent Genesis, where health emerges from the dynamic interplay of our mind, body, and relationships, and the deeper narratives we live by. What about safety? Under medical supervision, these treatments have shown to be generally safe, but they're not without risks. Psychedelics can produce challenging psychological experiences, sometimes intense fear, grief, or revisiting traumatic memories. This is why having a trained therapist present is essential. Certain psychiatric conditions like active psychosis or bipolar mania may be contraindications. Ketamine, while approved and widely used, has potential for misuse and can produce dissociative side effects. This is why rigorous screening and structured therapeutic frameworks are critical. Now, with all that in mind, where is the research heading? The field is growing rapidly. We expect potential FDA approval of MDMA-assisted therapy for PTSD within the next year or two, based on promising Phase 3 trials, though there has been some conflict here. Psilocybin may follow not long after, initially for treatment-resistant depression. Researchers are also exploring microdosing, though this is still very much in early, less conclusive stages. There's growing interest in combining psychedelics with other modalities, like mindfulness, somatic therapies, internal family systems, EMDR, or even digital health tools to deepen and personalize the healing process. And we're beginning to ask deeper questions. Can these experiences help us not only treat disease, but enhance overall well-being? Could they support processes of meaning-making, identity transformation, or spiritual growth? Now, how does all of this fit into a holistic plan of care? From an integrative or coherogenic perspective, psychedelic-assisted therapy might be one node in a much larger web. It's not a silver bullet. It may open doors, but we still walk the path through nutrition, sleep, relationships, stress management, physical activity, and ongoing psychological and physiological support. It may also be complemented by other approaches that help anchor new neural and behavioral patterns, from psychotherapy to bodywork, contemplative practices, and even targeted nutraceuticals or pharmaceuticals where needed. Healing, ultimately, is not just about rewiring the brain, it's about restoring coherence across our lived experience, reconnecting the fragmented parts of ourselves and realigning with what deeply matters. So in closing, psychedelic-assisted therapy represents one of the more exciting frontiers in mental health care today. We're seeing old taboos give way to rigorous science and thoughtful, compassionate clinical models. But it's not just about these substances themselves. It's about how they might help us tap into deeper processes of self-understanding, emotional release, and reconnection with life. As we continue to research and refine these therapies, my hope is that we integrate them wisely into a broader vision of care, one that sees people not just as brains to be medicated, but as complex, meaning-making beings in a continual dance of becoming. Thank you so much for being here today. If you enjoyed this content, please like and subscribe. Feel free to comment or ask questions in the comments below. Until next time, take care.